the total number of cases cumulative that we have as a district are 5. But 1, as I mentioned, gotten cured. So the active cases that are remaining are 4. Out of these 4, 2 were tested from Buyikwe district, and 2 were tested from Mukono district. It is very unfortunate and regrettable to mention that all these 4 cases, they are still alive. We have tried to get in touch with them. We are doing contact tracing. We are doing surveillance. We have used the security agencies. The RDC is aware. The DSO is aware about this. We have also involved the LC1 chairpersons and the village health teams, but we are failing to track them. As I speak now, our surveillance team is already in the field trying to trace these people. Now, this is not good news. When these people are in the community and we are failing to get them, that means that within a period of 2 weeks, we are likely to get very many cases in the district. Now, what does this imply? This implies that number 1, we need combined efforts. We need the efforts of the security agencies and all of us here. I wanted to propose whether it is possible to capture, in the future we are thinking of capturing their NINI numbers and also taking a picture of these people whom we are taking off samples from. Because this is very unfortunate. We have spent a lot of fuel last week tracing these people. When you make a phone call, like the one of whom I called, this case in Katosi, it was being received by a man. The man told me that is in Kubu. Others are telling us they are in Kisoro. And yet the records show that these cases are in the district. For instance, 2 cases are in the Seda. Here, our neighbor here, we have 2 cases there. One is from Mukono town. Another one is from Katosi landing site. But none of these ones has been traced. So this is very unfortunate and we are worried about this. Now, what are we going to do as a department? We are strengthening the surveillance system. We are also suggesting, actually I think by next week, we want to carry out mass testing at Namaojoro, Namatava, and all the administrative staff here at the district. We want to do mass testing, people from the bank and also some of the police stations. And we get to know how the situation is in the district. Because we might think that things are somehow okay, and yet that is not a true picture on the ground. And we are having challenges with fuel. Fuel to traverse the whole district. It is not easy for us to look for contacts. People are hiding. And the other thing which I want to mention as I conclude is about the directives. The directives are not being adhered to. Despite the government efforts, spending money to purchase the masks. When I move around, I don't see people putting on masks. And for me as a health worker, I'm not mandated to force people to put on masks. Apart from talking to them that you are supposed to put on masks, I meet them in the taxi park, I meet them everywhere. I will see people playing football in the football pitches. People have started, even you find very many people converging. I think you are aware, sometimes I send you messages so that you do what? You interview. Otherwise, if we continue like this, I don't know what is going to happen in the future. That we have also created another point of entry, and that is Namamve, Liberty ICD. It is a parking yard where we have very many trucker drivers. And we have already deployed health workers. I made a formal communication to your office. So currently, we have Namamve parking yard. We have Katosi Camp and Chetume, a designated place for trucker drivers also. And all sites have health workers, and they are working day and night on daily basis. Now, regarding the figures, so far the cases are rats which we have followed up ever since COVID started around 20th March. this year. There are 1,407 alerts. This is the cumulative from March up to yesterday. And out of these, we have taken off samples from 345 people. That is by yesterday's scale. Now,
no wonder the increase of teenage pregnancies. Children go back home late. They go to play, hide somewhere, do things. Yesterday I was discussing with the LC3 chairman of Nama, my colleague, and he told me of a certain girl who was impregnated and is trying to follow up where the young man went, but he ran away. It was through the things of meeting, playing, doing this. So there is a challenge. We need to cope these young people into this task force, just like we now have the representative of the PWDs. And so those are some of the areas that we've gone to, but I wanted to, like you asked us to give you a feedback on areas that we should carry out our immediate interventions. And we all know the markets. Chairman, yourself, I think you've been to the market down there and you saw the mess. I don't know who is letting who down,